Good morning, everyone. Oh, it's so good to see so many people joining this conversation we're going to have today. Um, we are very, very fortunate today to have Kim Dudek here to present to us the really exciting things about public health laws and policies and engaging boards of health, because who doesn't love engaging their boards of health, right? I'm just kidding. Anyway, welcome, and we're so glad that you're here. And with that, I pass it to you, Kim.
Thank you so much. I appreciate that. As Desiree said, I'm Kimberly Dudick. I'm based here in Missoula, and I will start a nice PowerPoint presentation that we've put together. And I'd really like to have this as interactive as possible today to give you just a little background of my lens and my passion, where I come to from public health. I started my career as a nurse, eventually ending up in neonatal intensive care. Decided I wanted to do things a little bit differently, became an attorney, missed public health. And so I studied public health and how we can improve population-based metrics. I specifically focused on child sexual abuse, know more about that, and hopefully ways to prevent it than most people would ever want to. And then I decided to do a little bit different and try to make our laws better. And so I served in our legislature for about 8 years, and now I'm back in the public health realm locally, and I love it. Public health is such a wonderful place, and we can do so much good. So, with that, I'm going to start my presentation, but I would also love for everyone, if you want, to put your name and where you're from in the chat, and then also what you're hoping to learn today so that we can make sure we cover and give you the tools that you need to really effectively work policy-wise and with your local Board of Health. So with that, I am going to share. There we go. I believe I just shared my screen with my PowerPoint presentation. Thank you. And if you ever have problems seeing this, please pop something into the chat. And Desiree and Anna are really doing a good job of keeping their eyes on that so we can make sure you can see it. So I'm curious, who's here today? I know we looked at the registration and it looks like we have a lot of people who work at local health departments, some possibly tribal health departments or government, maybe some medical providers, maybe some boards of health members, advocates, regular citizens, students. So if you want to also pop that in the chat, it'll really help inform and also help you share and build some camaraderie with the other people who are going to be here. And, as I said earlier, please put in there what you hope to learn today. I used to want to save the world, so I put that as like my hope. Like, I hope to save the world and make it better. And as I've grown older and been more humbled, I realize you can only affect a certain sphere, but I feel like public health is a great area to really have a broad impact. And you can really do a lot that really does eventually help save the world in different ways. So this is just a look at our agenda today. I wanted to give you an outline. It was covered in the meeting materials when you registered, but we're going to cover things like talking about how policies are developed locally at a statewide level. If there's interest, we can go beyond that in different ways. We'll talk about your local health departments, the Board of Health, whether it's a city board of health, city, county, or district. We have different types of boards of health that are made under Montana state law. So we'll briefly look at those, as well as what is necessary and what is provided for under the law for how to conduct those and participate. And we can talk about board of health meetings. And then we get into the really good stuff. So I love talking about strategy. Strategy and strategizing to me is like planning a big game and seeing how you're going to get to the end. So we'll talk about different strategies that you can use to work with your Board of Health, but also that you can use to work with your community, bring it together with the Board of Health, and if necessary, with state lawmakers who do hold some of the purse strings and also make some of the laws that impact our boards of health. So in some areas, we also have boards of health that may be more supportive of public health and those notions than others. So we can talk about ways to work in those areas, because just because you don't agree with someone doesn't mean you can't come to the same endpoint. And there's always a process for doing that. And then we'll talk briefly about some public health laws and statutes that are relevant to, policy development, but also the other areas then that I talked about. So it's just a primer. Most of us, I think, in this right now, this educational event are used to talking about public health, but not everyone has the same idea of what public health is. So here I put public health's mission, and this is from the American Public Health Association. And you'll see that the APHA, that is a national organization that has national meetings, but that also has many tools online that are free that you can use as a citizen, student, health department employee, or just somebody who wants to work in public health, to see how you can do that. And one of the things they have is great YouTube video that just is about 3 minutes long. And I wanted to share it because it really talks about what public health is. When we had the COVID pandemic, there was a lot of pushback against local public health authority, and many people only saw public health as that entity that's going to make you wear a mask and make you stay home and possibly close your business. So it's important that we change that mindset and talk really about what public health is, what it does, and why it matters for everyone. And so that is what this video is. And I'm going to try and share it here. Might just take a second to make sure that we get it where you can all see it. All right, so I'm going to ask first, can you see a YouTube screen that says APHA?
No.
Okay, I have to go out then. All right, I'm going to stop sharing. Then I'm going to reshare. All right. And hopefully you should be able to hear this, but let me know if you can't for some reason. Can you hear it? Thumbs up.
Public health is a vaccine that prevents disease.
Yep.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence.
We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
Okay. Now. All right. So with that kind of a lens, does anyone want to speak up about what is it like for them in their community about what public health is looked upon? Like, how do people perceive it, or how does your Board of Health interact with the public health department, or just community groups working in that area? Let's see. Does anyone want to put something in the chat here? I don't know. Does Desiree and Anna, do y'all want to say what you're seeing in the chat and share it?
Nothing yet. Some introductions, and folks from across all kinds of different spheres with respect to public health and the conversation. So it's really interesting to see, how many different folks are working in such a collective capacity to hopefully result in healthier communities.
Yeah, I agree. I'm looking through here just at what people were hoping to learn today, and it looks like people are hoping for insights on recommendations to help with possibly development of their community health improvement plan. Or they're, like you said, people are from across the state. I would love just to be a fly on the wall to hear the different perspectives about the boards of health in those areas. But with that, if nobody has anything in particular they want to share right now, that is totally fine, because people want to talk about advocacy and laws. So I'm going to get back to it. So with that, I'm resharing the presentation here. I believe I am. And let's see, I have a few things going on here. There we go. So you should be that. We just finished that with public health. So I think what we've heard and what we've probably seen is that there's a challenge right now and an opportunity. So public health is impacted by laws many times without policymakers really understanding what public health is, or how the laws that they're passing really will impact public health. And we see the same thing with our boards of health, that we see sometimes them making decisions in what may almost appear like a vacuum, because they may not be engaging as much with their local health department or community members and groups that will be impacted by their decisions as much as they could be. So many people are not certain how to advocate. There are also some restrictions on what people can do to advocate. So people are also concerned about whether or not what they're doing is legally permissible, and nobody wants to lose their job because of it or harm their health department. So a solution to that is that we can talk about what is permitted and useful to impact state and local policy, learn ways, talk about some real practical ways to become engaged with your local board of health, and to help them become more engaged with the community, so that they're really not only aware of what's going on in the community, but they have realized that they're the ones who can be an advocate and really help with the community needs that are in their areas. So as your outcome, hopefully you'll be able to influence the issues you're passionate about and what your community needs. Because, going back to what most of us want to do is make the world a better place. And that is really why we're in public health. So let's see. There we go. Oops. Hold on, I went too fast. Policy development. So I'm curious, has anyone actually been involved in policy development? I'm betting that some people here have. You can put what you've done in the chat if you're interested. We're not going to be breaking out into small groups unless everyone really wants to. But that was something that I didn't really think would be really productive. But so if we look at who is doing policy development and who's authorized to do it by law in our state, this is where we're talking about. There's a lot going on federally right now, and a lot of that is up in the air because of the institutions and safeguards we have. So we won't really be talking about that at all today because we don't know what the answers are yet. We're going to focus on what's happening in our state and what we can do in our communities. So right now, the legislature is in session in Montana. And during that time, the governor will be signing laws, possibly vetoing laws. But the governor is the one who signs those laws that come out of our legislature. But you also have a lot of policy development going on locally. You see our county commissioners doing it, our mayors, if you have a mayor. But then we also see health department staff who are involved in policy development. It may be what they're doing within the health department, or they may be working with their Board of Health to pass some regulations that the Board of Health is able to do. But then we also see like who else can impact policy. Like number 5 there, we have community groups. They can't pass policy, but they can identify the needs we have, and then they can see what has been done in other areas, or they can identify a champion, somebody who's going to be their champion and actually work with lawmakers or the Board of Health or their local mayor or county commissioners to really get things done in the way they need. And organizations can do the same thing. Where, MPHA, the Montana Public Health Association, is one such organization that it has very big concerns about public health and is working to ensure that the members that it has are informed and that if necessary that they have input into in a way whatever is possible into the laws being passed right now. Then we have lawmakers in Montana. We have a legislature that is elected. It's made of 100 people in the House and 50 people in the Senate. So we have a bicameral legislature that meets every 2 years. And there are 2 representatives for every 1 Senate district. So that's why there's 100 representatives, 50 senators. And we have those individuals representing our communities and making laws. And so everybody who is lives in Montana, who works in government, who works at an organization, has the opportunity really to connect with our lawmakers and talk with them. We're lucky in Montana because we are such a small population-wise state that you actually can talk with your local elected officials, whether it's, again, your mayor or your county commissioners or even your lawmakers, your legislators. You can do that. So if you're interested, a little bit of searching online will give you their contact information. And then also with policy development, we have lobbyists who, some people hear that term and they think lobbyist is a bad word, but lobbyists really are the ones who help groups like schools or health associations impact the laws that may help or hurt their communities. So even though lobbyists traditionally have not been looked at as that kind of an agent to really help the public good when it comes to health, it is something that is really occurring now, and that we're really fortunate to have organizations like Confluence and other organizations that will work with lobbyists to help with that. And then I put there at the end, who else is doing policy development? Schools do it, and they have school districts. If you want to get involved locally, serve on a school board. We need good people. And they also pass rules, but then they also may want to be involved in state lawmaking. And we have churches, sometimes they get involved, whether or not they should, based on their tax status is debatable, but they do sometimes get involved. And we also have unions, such as representing carpenters or teachers, that will get involved. And there's other areas, but this is just basically, it's a broad swath of who is really involved in policy development. So it's a lot of people. All right, so let's talk strategy. If you're going to get involved in policy making in all those ways that we just looked at with all those people, you need to figure out what you're going to do, the approach you or a group want to take, and how you're going to get it done. And there's really a few things you need to consider, and this is going to get into how you start advocating and how you can work with your Board of Health. So if you're going to do something, first of all, you want to know what the facts are, the real facts. You may be told things that aren't really accurate, and so you really want to make sure you have the facts. And then you want to figure out what the message is you want to give, when the message should come, because sometimes when the message comes is really important, based on funding issues or maybe what could be done at that time. And then the last thing is, who is the messenger? And this is really important, and I'll just give you one example. If you are talking about regulating businesses and how that might lead to an increased fee, having your local government come in and say, we want to raise these fees because we need more money, they're probably not the messenger that you want. Because if you really do need to raise those fees to receive more funding for a project, maybe it's for a school, you're probably going to want to look at other messengers. If it's a school, maybe you want to talk about the school. You have the school be the messengers, the families. Or if it's a business that's going to be regulated, start working with those business members, other businesses, and have them be the ones who are the messengers, because they'll be the ones who are impacted. So you have to think about message. And something else to think about is locality. And really, that's where people are located. There is a belief sometimes that if you're from Missoula and you go to Eastern Montana, which is not Billings, I'm told, it is Eastern Montana, like Miles City. If you go to Miles City and tell them this works in Missoula, they probably are not going to want to hear what you have to say, because they're very different areas. But if you have another small area that's more rural, such as Sula, which is very rural, if you have somewhere like that and you work with them and then they're the messengers with Miles City to whatever message you have, they're actually going to connect and maybe actually get something done there. So you do want to think about, when you're talking about messengers, even though you may know everything, you may not be the messenger who's actually going to be able to get it done for your group. And then so this is a timeline. I love timelines because they help you conceptualize things. So this timeline is looking at the Board of Health, when they meet and when our state legislature meets. And the reason I put this up there is because many times people get really excited about state laws that impact localities when the legislature is in session. But that's only, it's actually 4 months. It's 90 days, 90 out of every other year. And there's a lot that goes on in between that time that is an opportunity for working with your Board of Health, or for working with your community or your lawmakers to make some changes. So as you see, the first line is January, and that would be it would be an odd numbered year. So it would be a legislative year. Legislature always meets in odd numbered years in the wintertime. I think that started because it was a lot of farmers and ranchers at first, and so they had time in the winter to go to Helena to do this, the legislature. But as you see, they meet for, and that's that little red bar there, when the legislature is in session between January and April. It's a very small amount of time. But then after that, you see from April through the end of the year, the green, and that shows when there is what's called an interim session. And there are a lot of committees that meet around issues like health, finance, budget, everything in the state. I won't list them all out, but it's the things that we care about, local government, that they have these interim session meetings, and you can get involved during those. You can find out who's on those committees, what they'll be studying, and then how you can be involved with that. So the interim committees meet about every 2 to 3 months. It really depends on the committee. These are all not specifics, but they're general principles here. So they meet from about June of one year through September of the next. And so the interim committees meet, and during that time, if you have a local health department that meets every month, you have over 12 meetings that your local health department may be having during that time. And they may care about what's going on in those interim committees, or you may care and want to start talking to them about it. And then you'll see on the bottom line there in September, the legislature, the interim session, the committees wrap up their work, and they usually have reports. And then we're getting close to election time in November. So that's the hot pink, because it's a hot time in Montana. So we do that, and then the whole thing starts over again. You'll see with legislation and policies, sometimes it takes more than one push. And you got to remember it's a marathon, not a sprint. And sometimes it just takes a lot of work to get things done and to build relationships that get things done. All of that's really important. So that's the timeline of what that all looks like. And then next, I wanted to cover this because it's important. And it's one of those things that people may have some uncertainty about, and which uncertainty can lead to fear. So people think sometimes that because you are in a local government or you are in a local health department, that you cannot do anything to talk about policies or to talk about what would happen with laws if they're passed, or if your health department or your board of health does certain things, that you just have to sit and be quiet. And that is actually not accurate. In a personal capacity, people still have their rights under the First Amendment, but we're not really going to go into that. But this is in a professional capacity here. So on the left-hand side of the screen, you have, this looks like a pimento olive to me. I'll just be honest with that after I put it together. So on the left-hand side, we have the pimento, and that is lobbying. And so lobbying is a very strict thing that's defined in Montana law. And it is when you ask, and this is not the exact definition, but it's an easy way to understand it. It's when you ask legislators to vote a certain way on a bill, that's called direct lobbying. So if you were to call up your lawmaker who's sitting over there in Helena right now, or send an email and say, please support House Bill 200 because it's awesome, or don't support it because it's the worst thing ever, that is direct lobbying. And also, indirect lobbying is more if you organize supporters to contact legislators, or you publish materials that advocate for or against a certain law that is being considered. So that is all lobbying. And now in the middle, you'll see the pimento and the olive have come together. And this is saying that all lobbying is advocacy, but not all advocacy is lobbying. And this is the area where a lot of people can have a big impact, because in public health, in our professions, we know a lot of information, and we know what would happen as an impact of certain policies passed. So this with advocacy is all about educating and raising and championing issues so that you are trying to educate about what will happen with certain laws or policies. It's not necessarily around a specific proposed law, but if it is, then you're not asking for support or opposition for a law. All you're saying is this is what will happen if this law is passed. And so if you go and testify in the legislature, don't ever do that without talking to your boss first of all. But if you do go and testify, sometimes you can test as an informational witness. So you're not for a bill, you're not against a bill. All you are is telling them information. And that is frequently where public health has a big opportunity. And so with that, I'm going to open it up right now. Are there any questions that anyone has, or anything that you'd like to ask? You can unmute yourself or put it in the chat, and Anna and Desiree can see if there's anything there.
Hi, Kimberly. I had a quick question. I was actually typing the question as you kind of answered it, but how to clarify how we testify as a proponent at a committee hearing and keep that from being lobbying, because as I've seen it, and being an informational witness, you don't necessarily get to make any statements unless they ask you questions.
Mm-hmm. Yes, so that is accurate. that is accurate to an extent. There are rules that are passed at the beginning of every legislative session, and also the committee chairperson can set specific rules for how committee runs. And what we've seen in the past few sessions are exactly what you're talking about. Informational witnesses can't just come up and talk. They have to be called up there and then asked questions. And so that is accurate. The way to work with that, because sometimes those are just the rules, is to contact, and again, when I say doing this, it should all be done. Make sure your supervisor is aware of it if you're going to be doing any of this on work time. And also you want to make sure that you aren't crossing the line to lobbying, because that can be an issue. But what you can do is then you find out, and at this point in time, it's usually the Democrats who have been more in favor of public health issues and funding, but you would find out that's not always true. First of all, you would find out who on the committee is in favor of what you're talking about. And if you're not sure, then you can ask the people on this phone call, but also ask, MPHA or those other Confluence, and see who should you reach out to have them ask you questions so that you can give the information. So you're basically telling them what they should ask you, because you're setting up what you need to tell publicly and have that be part of the public record. So you have to kind of take some steps beforehand. It's almost like asking yourself out on a date, because you're laying the groundwork for what needs to happen. But in doing that, you will provide the opportunity for the public to hear the information you have. That being said, sometimes our legislature can be caustic, and some of the lawmakers sometimes have really put strict restrictions on how long somebody can talk, who can talk, or how many witnesses they could have. And so it's always a good idea to feel things out and talk to the people involved, the lobbying groups involved, so that you know what's happening and you can be part of the general movement to help or oppose a bill, just through your words. Even though you're not going to say vote for this bill or against it, you can say this law as passed will harm these people because it will take away the funds for early Head Start, which puts children, leaps and bounds ahead of those who don't receive it.
Yeah, you're just stating the impact. Yeah.
Yeah.
Do they allow informational witness statements to be submitted to the committee? Is that another way?
That again, I would say yes, with a caveat in that it depends on the specific rules and the chairperson. But I think that having a witness statement is always a good way to have your words put into the public record in case time does run out and other witnesses aren't allowed. So I think that is a really good way to do it.
This isn't a question, but a comment.
I'm sorry, Stephanie, did you have anything else?
No, just not a question or comment, but as you're describing this process, I think to myself, boy, I'm really glad Confluence and the three organizations under the umbrella, have a legislative working group.
Yeah, it's really important that public health doesn't get left out of the mix, which for too long has really happened. Todd Hardwell, I see your hand is up. Why don't you go ahead?
Yeah, hey, thanks, Kim. And I was just kind of add into that conversation you were just having. And the one thing you could do, say, if you're informational, is prior to the hearing, just submit information like a one-pager to committee members prior to it, so they have it in front of them. So they might be more likely, if you're an informational witness, to ask you to come up and provide testimony on X, Y, and Z. And it kind of greases the wheels too for them, and maybe educates them on issues they might not be aware of. So, yeah. Thank you.
That was a really good point, Todd. Thank you for bringing that up. Because a lot of it is, if we want to spread the correct information and not misinformation, and that's a really good way to do it. Did anybody else have any questions or anything else you wanted to say? All right. Well, let's keep moving on then. So I'm curious, and Todd, I may actually ask you about this, but your experience might be enriching for the conversation. Who's actually been involved in advocacy or in lobbying, knowing, and I put here that there are those limitations that exist. There's a federal law called the Hatch Act, And that federal law does impact local governments, and you have to be careful about how much advocacy you're doing for legislation if you receive federal funds, is in general terms about what that does. But then who else has been involved in any sort of advocacy, and what have they seen be really impactful and useful for their areas? Does anyone want to volunteer anything? All right, Todd, I actually might ask you, could you, I mean, if you don't mind me putting you on the spot, but I would really be interested if you wanted to share with people what you've seen as the best way for local people, local health departments to really have an impact on the policies that are going to affect them.
I think like during session or prior to session, I guess a couple things. One is thinking about who's the appropriate and best messenger. It might not be the health officer or public health staff. It might be the Board of Health member from the community or the commissioners. So you kind of got to get a feel of who's on the committee, who's hearing the bills, and who's maybe the best messenger to deliver the messages. I think too, just come into it not in an adversarial type of way. Just it's like, explain to folks, because a lot of folks don't understand what public health is other than, oh, we give vaccines and these things. But I think just giving a little background about we work in public health. Here's our role, either as a health officer, as a Board of Health member, or as the county commissioner. We're supportive of this bill or potentially have concerns about the bill. Like, don't go on the attack. Yeah, I mean, I'm trying to think what else. That's kind of it for right now, Kim. I might come back later.
That'd be great. Thanks, Todd. Thank you. Does anybody else have anything that they've put in the chat or that you'd like to add?
Yes, Kim, there's something in the chat. Kirsten, is asking, is there a place or a website where we can see what House bills are being presented?
Yes, so you can, and let's see. I won't stop this share just because I don't want to mess things up, but if you type into your browser Montana Legislature, it should pop up with the general legislative website. And that website it'll say what session we're in. And then it also has a calendar that shows you all of the calendar days, but it then shows all of the committees and what is scheduled for each committee during that day. You can then log on and actually watch live testimony. And there's supposed to be notice given, I think it's 3 days in advance, although sometimes that doesn't always happen, before bill hearings are had. So there is a way. You can also see bills that aren't yet scheduled for hearings, but that are being drafted by different legislators, whether it's just on hold or if they're in the process of doing it. So there is also another part on there where you can search by keywords, or you can look in specific areas such as maybe senior citizens or budget or childcare. There are different ways of looking at what's out there, and then you can actually make a way to track all of the bills that you care about. And so then you can see that, and you don't have to go through the whole search process every single time. So we do have a good legislative website for that. So the answer is yes. And then also, if you're actually in Helena, they do in the Capitol, they do post paper every morning. There is a big bulletin board, and they will have all of the scheduled bills and what committees they're in and what room they're in there. So it's not just online, but they actually do have it posted there too. So it's really accessible for people.
Hey, Kim, can I add one more thing? It just came to my
Please
mind.
do.
Yeah, you brought it up, but I think it's super important. I guess two things. One is the best surprise is no surprise. So definitely have internal discussions with your health officer or your Board of Health and or your county commissioners about legislation that you feel like your jurisdiction wants to take a stand on or be informational on, it's always best to make sure everybody's in the loop. I know many jurisdictions don't necessarily have like a laid out process, but that is something, and I know we're in the middle of the session now, but that's something that would be helpful for the future to have discussions with the Board of Health commissioners and the health officer about having a process in place so you can move quickly because things happen fast.
Yes, that is really true. Things happen fast, and sometimes things happen in a way that you don't even know it's going to happen. And just to give you an instance of that, I had said how you can have a bill and they're supposed to have so many days or so many hours notice prior to a hearing. What can happen though is that somebody can make a motion during a hearing to amend certain things into a bill that maybe are really terrible from another bill that's already been killed, but they're trying to amend it into this other maybe good bill or just okay bill. And you wouldn't even be aware of that because it wasn't really what the bill was supposed to be about, maybe just tangentially. So things do happen very fast. And I think Todd has a really good point that there shouldn't be surprises. And the more you can plan beforehand, and like I think like somebody said earlier with having Confluence and AMFO and MIHA and MPHA, all of those organizations really help. And the more we can be organized through those, I think the more impact we can have as public health. Was there anything else in there?
Yep, Raven has shared that
Great.
setting up an account in Bill Tracker is super helpful. If you set up your keywords, it'll help you find relevant bills and you can add them to your calendar. And Stephanie is asking, are the notices just posted on the website?
The notices are posted on the website, but paper copies are posted in the Capitol. And I believe that that's sufficient for public notice as far as what the legislature does. I've never heard of them. I'm trying to recall. I haven't really heard of them being posted elsewhere. They may be, but as far as requirements, I don't know that there are any for that. Okay, cool. So let's talk now. Let's see. Yeah, we'll get into this and then we'll take a quick break if anyone needs to stretch their legs or get a cup of tea or coffee. So I talked earlier, I said there are different types of boards of health and how they're organized. Some are city boards of health. I think that Billings has a city board of health. Some are county boards of health. And I think Ravalli County has a county board of health, but then there are also city county boards of health. And that is what Missoula has. I think Butte might have it, but I'm not certain on that. So there are different ways that they are configured under state law, but they're all pretty much the same. And so I put here just, I won't read it to you because you all can see it, but also it is the Montana Code Annotated, which is what MCA stands for. And some of that's a little dense. But basically you have your County Board of Health, which is what this one is for. And MCA is Montana Code Annotated. Title, let's see, 52104, and that's how you actually find it. All of that is actually available. If you actually plug that into online, it would bring you to a link you could read this. And it just says what the County Board of Health is. That's the county commissioners, members appointed by them, serving at their pleasure so that they could be, if there was no longer at their pleasure, they could be let go from that position. Minimum of 5 people. And then they do serve staggered terms for 3 years each. And in that situation, it's up to the county to maintain that. And then we also have city boards of health. And so this is similar. You'll see that the people who are appointed are a little bit different. They're appointed by the city, the governing body, and the terms are staggered, and they're for 3 years. Again, that's typically what you see with boards of health. We have city county ones, and the city and counties will have an interlocal agreement, typically considering who does what, who pays for what, and how it will operate. And those, once they're in existence, they usually get renewed, somewhat modified. And then again, you'll see the people who are appointed to that and who participate. 5 people, 3 years. And then we have district boards of health, when 2 or more adjacent counties. So that would typically probably be those with less population. But first or class cities located in those counties can elect to be included. And so then you have, again, what that looks like, who's appointed, and that additional members can be appointed. And let's see, the powers of the board. So this is for all boards of health. So the powers actually do not change for the most part based on which kind you have. There were some changes made. Does anyone remember COVID and masking and boards of health and how the legislature here in Montana changed their powers? Well, it happened. It happened after COVID, and it happened because there was a push to have less, I would say a little bit less power for the Board of Health than what they had before. So the laws have changed within the past 10 years. But I think it's important to note that boards of health, they are not merely advisory. They aren't just there to advise like maybe city council or the county commission. They do have powers. And even though some of those powers were changed, they do have a very long statute that I listed there at 52-116 that gives a lot of powers. So they recommend the appointment of the health officer, elect their officers to run at the Board of Health as necessary. They have to have bylaws to govern how the meetings go. It's always good to have bylaws because then people know what to expect. And if you don't know the laws, it's kind of like playing a game. If you don't know the rules, then you're probably not going to be really effective in what you're playing. So it's really important to have effective, good bylaws. And then also they have to hold regular meetings, at least quarterly, and if necessary, hold special meetings. Then like I said, there is a long statute that talks about this, but here are some of the other powers of the board, but some of their duties. And so they have to work through all of these issues with dealing with epidemiology, screening and testing diseases, isolation, quarantine. If you're thinking of COVID, then yes, that is related to this, but they didn't lose that power. So they still have these powers for treating, diagnosing diseases, getting rid of public nuisances, inspecting. That happens a lot with maybe pools or sewers, waters, businesses, restaurants. Collect, maintain health information. And I think as we talked earlier, there are vaccinations given. And so we do have to have a way to track that and to make sure it's safe and that it's secure. And then there's other education, training of health professionals, but then other things that they can do. And then here's just the last part of this I wanted to include is that they can protect the public from diseases. They can supervise or make inspections, bring actions and issue orders if there is something necessary for abatement, such as a nuisance, or sometimes we hear a lot about junk vehicles, or we have had some issues with people thinking the health board has the authority just to haul a camper that somebody may be living in, which is their home, and just haul it away because they don't like where it is. And so it can get into some really important issues that impact a lot of people, and that the boards of health, they are involved with those. Then they also propose for adoption the necessary regulations. So they do a lot of regulations dealing with sewage, water, and other things. If a variance is going to be granted, there have to be clear standards for that also. So those are some of the factors that are some of the issues involved in just that specific statute. Then just a couple other things I just wanted to note was the funding for our boards of health. This is impacted through whatever governing body, be it a city, a county, or the city and county or district. It's through budget appropriations that the local agency will pay for their board of health. But then you can also get grants from official and non-official agencies. And we see a lot of those grants possibly through, the NIH, the National Institutes of Health, maybe through DPHHS at the state. So there are other opportunities for funding. And then when legal questions come up, you don't just go out and hire an attorney. If your county does have a county attorney, that's your legal advisor. And so usually there's one person at the county, especially in larger counties, who will be the designated legal advisor for boards of health. And so I wanted to talk about this, but before we do that, I think we should just take a quick break, like 5 minutes. If you have any questions, throw them in the chat, because when we come back, I thought we could hear from people about, just with what we've been talking about, these two different, case scenarios, and how could you work with your local Board of Health? What do you think now? What should happen? And then we're going to go into more strategy and work behind the scenes on that when we come back. So if everyone is good with that, throw things in the chat, and let's take just a quick 5-minute break. So I have 9:50 on my phone at 9:55, and then we can be back. Sound good? Also looking, and a recording is in progress, which is awesome. And I'm looking here just at what people are putting into the chat, and everyone has such good ideas. And it is great to see that. So let's see here, to move things around. I'll stop my screen share, and then I'm going to re-screen share it, so I don't screen share the chat like that. So let's talk about this. We have two scenarios here. Oh, before I start, I saw the comment about how do you start dipping your toe into the water of advocacy. I'm going to cover that later on. So we will talk about little baby steps we can take. And in saying that, I say in just baby steps because I have 4 kids and I've seen a lot of baby steps, and so it's on my mind. But honestly, any step forward is a step in the right direction. And it's just like taking a hike. As long as you keep putting one foot in front of the other, eventually you'll get there. It may take a long time, but do what you're comfortable with. And we can talk about different ways of doing that as we go forward. And some things may, you may warm to them, others you may not. And I think that everyone has their own tolerance for what's good when it comes to advocacy. Okay, so, all right, so case scenario 1 here. Your local health department wants to increase business inspection fees. Oh, we love it when we increase fees. You know what they're called in the legislature? Anyone, please shout it out. Come on. Fees? What else are they called? Taxes. That is what they are called. And anytime you try to call them otherwise, there will be people, maybe not even the legislature, but just locally, those very vocal people who do not want to pay more in taxes, which is understandable. So taxes are fees. And we can call them whatever we want, but they're fees. And then so the second one here, the local health department thinks that they might have to recommend masking. I mean, I know that we actually had a lot of turnover in our health departments during COVID and after. Some had more than others. Many had 50%, if not more, like 75. Smaller ones, 100%. There was a lot of trauma associated with masking and how public health department people were treated and how boards of health were treated during the pandemic. So it's a very touchy subject, and thinking about it again, it might be kind of scary for some people. So with that in mind, the things you start thinking through, and I saw some stuff put into the chat, which is great, is what should happen? Okay, so what should happen and who should be doing it? Who has the power to raise local inspection fees, or who has the power to recommend masking? Who are the messengers? I saw in the chat that somebody had commented that messengers might be, for the local health department raising inspection fees, a local business. And that's actually something that's right on point and happening right now in our legislature. Is there's been a movement for the past many years in legislative sessions to look at business inspection fees and how they haven't been increased even to keep up with inflation. And that is because fees, when they're set in law, they have to be changed by a law unless they're said to automatically adjust with inflation. as a side note, when I was a lawmaker, I once proposed to that. And I think the person's head who I was talking to nearly exploded. And they're like, that would just continually raise taxes. And I'm like, well, I mean, that's what we need, right? That didn't go anywhere, but we had the conversation. And so there's another way actually with fees is to have it set an administrative rule. And I don't know, raise a hand here. Who's actually dealt with administrative rules? If you have, go into your little bar there about how you can react and raise a hand if you've had to deal with those administrative rules. Todd has. He didn't just raise a hand, he gave a thumbs up. All right, Aaron did. Great. So does anyone want to talk about their experience with those administrative rules and how they're different from just getting laws passed? Oh, I saw Todd unmute himself. Go ahead, Todd.
Yeah, so for the state, for DPHHS, so the legislature by law can give the department the authority to like proclamate rules. There's a big word, basically. And what the whole point of rules are is laws can be somewhat vague sometimes in terms of the exact meaning and how they should be implemented. So rules are an authority given to the state agencies for the state. There's also local regulations you guys can work on, but it's a tool for us to flush out more the actual implementation of the law. So examples are, we do rule changes and rules all the time at the department. If you guys remember, one big change over the last couple of years was making requirements. There's a section in our rules related to school health, and we made rules to flush out requirements for schools to do annual or routine water testing to prevent kids from being exposed to heavy metals like lead. And it's a long, arduous process, but it's a good tool to have because it provides more clarity, and we can also be more timely with health issues that are currently coming at us too.
Yeah. Yeah, I agree with all of that, Todd. And I actually, you just reminded me of something that is something that people should think about in between the legislative sessions. And if you are really excited or scared about something that was passed, either way, you may want to pay attention to what those rules are. They are publicly noticed on the legislative website, I believe. I think that's where it is. But they are publicly noticed and you can review them. And sometimes the way those rules are written, it may actually not correspond with what the intent behind a proposed law was. I recall there was one time when I was in the legislature that I sat on the budget committee. It was called finance. It was the interim committee, the finance committee. And we actually there was a law that was passed that was going to be implemented through the rules when they were drafted, and it would have had an impact that was different than what was intended. And we had all known what was intended because most of us in that committee had been involved with the bill. And so when we saw what the proposed rules were, we actually communicated back to the government entity who was going to be promulgating those rules, which is, Todd said, is a big word, but it just means putting them in place. And we said, this is actually, we object to this because it is not with the spirit of what this law meant. And so even once a law is passed, that's not necessarily the end of it, because there are sometimes more of those details that do get implemented through rule. So it's an important way to stay aware of what's going on, but also maybe have an impact in that. And we'll talk a little bit later. I know people are interested to know how can they have an impact. Go ahead, Todd.
One other thing you just reminded me of too, I just wanted to share because I think it's super important. There is public notice on the rules for review and public hearings, but also one thing we've tried historically for years in Public Health and Safety Division is to, like if we're going to change environmental health rules or update them on tattooing or food safety or whatever, we would share the drafts out to the sanitarians and the health officers to get feedback before we even get to the public notice, because we want to make sure we're in line with what the reality is for you guys with the boots on the ground. So I'm assuming that will continue for all of our rules that impact you guys as local and tribal health departments. Thanks, Kim.
Yeah, thank you, Todd. No, I think your experience is really valuable here because you have been working on that inside of the government, working in that area. And, I've been involved in local government and I was involved in the legislature, but actually being the inside of that government entity is a little bit different. So it's great to have that perspective. So the second case here we talked about was the local health department. If they have to recommend masking again, even like, I think that Todd actually hit on something, even before they have that conversation, they will probably want to start talking with, who do we think? I know we've been talking about the business community, but also the schools, your local school board, your teachers' unions. All of those conversations should be happening before the health department makes some sort of recommendation, if you don't want surprises. Surprises can be the death to any good policy just because people don't understand it. And the rule has always been, if you don't know what a law does or a policy does, you should vote no, is what I've been told, because otherwise you could have really unintended consequences. So you want to make sure that, and so that's if you're not informing those people who have to vote on this, what really is the basis for it and the impact, then they may not support it. But when we were talking about the messenger for that, I thought it was important that somebody said that if you're looking at who should be the messenger, maybe the parent of a child with asthma, and that they would actually be the messenger as to why masking is important. So there are different ways of looking at messengers and the importance of that. Okay, let's see, let's go on to this. So these are some facts to consider if you're, and it goes back to a slide we saw earlier, but if you're going to be pushing for something or you want to be involved with something, what are the facts? What are the message? If you're going to be involved, at what time is that appropriate? And then who's the right messenger? And you have to know, if you're going to be working with your local board of health, it's always good to kind of know, you want to, God, I about said pregame it because I was thinking of the Super Bowl. It's on my mind, but you want to do some pre-work and know, is the board supportive of this? What have people heard? What has been the past experience? If you want to try and work with your board of health to have them support a fee increase or to have them support, masking, or, and those are just general things. Maybe it has to do with septic systems or subdivision development, or something that's been kind of hot in our area is with grizzly bears and bear-proof cans. If you want your board to support that, you want to do your groundwork and know what is going on. And then you also want to know, what if your board, what if they don't have to be involved in an issue that the health department can deal with? And you don't want to make it a really big thing. Perhaps it is a state issue. And if you know that trying to get them involved without getting them educated on the issue and the impacts, if it might create more of a barrier and then potentially harm people, you might want to think really carefully and talk with others and prioritize how are you going to strategically involve them, educate them, and make them one of your potential partners. Decide what your priorities are, and then also who are your other partners, possibly throughout the state or at other health departments, maybe in businesses. Businesses don't want their employees sick. They don't want their employees to not be able to work. And if we're talking about an issue like Medicaid coverage, then having actually a healthy workforce and those covered with health benefits is good for businesses. So you have to kind of broaden your mind sometime when you're thinking about things like that, about who could be your people when you're working on issues. So, and now we're going to get into more, if people want to start really getting involved, what's it going to look like? So we've talked about the basic format of a Board of Health. If you've seen a Board of Health meeting, you know that the chairperson will call to order, and then there is an agenda that is typically publicly noticed. And then they will go through old business, new business. They may have a hearing of some sort where people come and testify about wanting to have a variance from regulations because they want an additional septic field in their land, but the way that the restrictions are now, they can't do that. So that's what it looks like for a Board of Health hearing when they occur. And then the Board of Health may have different people come up and testify. So like, how can the Board of Health hear from staff at a health department? Like, I wonder, maybe do a brief, landscape survey. What does your jurisdiction look like? Does your Board of Health hear from staff at meetings? Does the Board of Health hear a report about maybe an important healthcare worker program that you have and the impact it's having on individuals' lives? And if you don't include something like that currently in your Board of Health meetings, maybe figure out how you can do that so that you can get your Board of Health more acquainted with what is actually going on in your community, but from your public health standpoint, from your work. And then also, like, how can you connect your Board of Health with the community? So I have another slide on this and we'll talk about it in more detail, but it's interesting because this is more of like a chess game. So if you want people to come together, it's like, what pieces do you have to move to create the pathways to make that happen? If you want to, for example, going back to our first case scenario, raise inspection fees on tattoo parlors, you should probably figure out ways, how are you going to have your Board of Health connect with those businesses, the tattoo parlors, or body art as they're called in some areas? So how can you, through your work or through your health department's work, make those connections with your Board of Health to start using them and building that education so that they're actually our biggest champions when they see that, oh, those body art parlors actually want to have their fees raised because they want to make sure that they're inspected and that their people get the training, but also that those that aren't don't give them a bad name. So that's kind of the connections you're looking to make. And then there's the big number 3 there. What if your Board of Health does not support public health? And I think that sometimes we say things and we just kind of put a period at it, but we don't really look at, and I put underneath there, well, what more? Like, what does that really mean? If somebody says they don't support public health, then in their mind, public health is this thing that they don't support. But if you start talking to them about what public health really does, like it gives vaccinations for children, and it makes sure that people who don't have access to food can eat. And then if you really start having these reports from your staff about what public health does, maybe bring a board member to work day, and the board member can get a tour of different programs and see really what goes on at the facility. And then maybe through this education and work, they can see more what you do. And in addition to that, you can start finding out from them, what are their guiding principles? Like, what are their priorities? Do they not want government intrusion into people's lives? Well, I think a lot of us feel that way. But what does that really mean? And is like your health department doing that? So they may think that it means one thing when in fact it doesn't. And so even though you're coming at it from different perspectives, you actually agree on the same points. So it's important to have those conversations and really, as we talked about before, not be adversarial about it. Most people are trying to do good and they think that what they're doing is helping. So understanding how and why can be tricky, but it's something that can be done if really there's the time devoted to it. Just to give you an example in my work of how that happened, when I was, I'll go in the legislature. So when I was in the legislature, I was on the budget committee, and I like spending for programs that are good for people. And I wanted to make sure that I was on the criminal justice subcommittee. And so we looked at all of the budgets for our courts, corrections, Public Service Commission was in there for some reason, but we looked at how we had these some were high rates of like repeat offenders, and people weren't getting the rehabilitation they needed if they were put in, like either the prison or the jail, and maybe they didn't even have to go there. So from a social justice standpoint, me and a few other of the legislators I worked with were really concerned about this and wanted to find out ways from a social justice standpoint how to make this better for our communities. And so we started talking with other legislators who were not so concerned about social justice, but who were concerned about the bottom fiscal line and how much money was being spent. So they saw possibly changing some of the ways that services were provided or that things happened. If some of those were cut or redirected, that it would save money. But at the same time, when they were talking about what they wanted to do, we were like, yes, it saves money. And look, it's actually helping people. You're being a social justice advocate, even if you don't know it. And so we were able to come at it, and that's a very simplistic viewpoint of it, but we were able to come at it from two very different viewpoints, but we came to the middle. And we didn't have to agree on everything as long as we came to the end point that mattered to both of us. And that's actually how you can really get things done, is finding out what people really is important to them, and whether it's your lawmaker or your board of health or your local chamber of commerce, finding out those people in authority, what's important to them, and then how you can help with their goals. And so before I go on, I just wanted to open it up. Did anybody have anything they wanted to add there, or any questions they had? All right, cool. Then we will just keep going on. So this goes back to a question I saw in the chat, is like, what do you do if you just want to try this out, dipping your toe in the water? So it's basically, how do you prepare yourself? How can you get involved, feel like you know what you're doing? So to prepare yourself, I put here, read peer-reviewed journals. I mean, really, I don't know how many people are going to access peer-reviewed journals. That being said, I know some people do have them because of their profession or because they're required to do it. So I did put that there, but it's a good way to stay up with things, but also keep up with current news. Like, see what's going on in your community and focus locally as much as you can, because it is really easy to get pulled into national or world perspectives that don't necessarily have a groundbreaking impact right now in our communities. And we could actually do a lot more work locally. So focus on reading news from multiple sources, being aware of the current health issues in your community, country, and world. Don't stick your head in the sand, but again, focus on what you can impact. And sometimes you need to really step back from the whirlwind of information that we're bombarded with every day, and just center yourself and make sure that you're self-regulating so that your emotions aren't going up and down and you're in this constant cycle of worry and then checking out, because that's not good for you or for anyone else. So self-regulation, just kind of personally, is important in this. Do what you can, and then if you need to take a break, that's okay. And then other sources here, news, peer-reviewed journals, information by organizations. And I said, like the CDC, they have a website, and you can also sign up for email alerts about different things, not just from the CDC, but I put a link there to the American Public Health Association. They have a page with their publications, and they are a non-biased public health information source. And they also have realized in the last few years that they need to step up their advocacy. And they have specific information on advocacy, who's doing what, how you can be involved, messages you can share. And I have links for this later in this PowerPoint presentation, which I'll share, and so that Desiree and Anna can make it available. But the American Public Health Association really is doing a lot of work in that area to provide people with the resources they need to effectively and comfortably be involved. And then now here's how to interact with your Board of Health. First and foremost, talk to your supervisor if you are employed somewhere where either at a health department or a community organization. Let your supervisor know what your thoughts are. Talk to them about opportunities. if you let them, know your thoughts, maybe there's an opportunity to give a report to the board about health programs, about your health program, about the community health assessment that you just did, or even if you didn't do a complete assessment, about some community factors that are going on, that exist in your community, but then also about your programs and what they do and how they impact it. It's the boards love to hear from real people, like not the ones who are necessarily in a supervisory role, but from the real people on the ground, what they're doing and how it's helping people. So that's also a time to talk about unmet needs, the impact of programs, but also what you're seeing that hasn't been met yet. And if you can start bringing that kind of a conversation to your Board of Health about unmet needs, maybe it's not from a public health, local health department employee, maybe it's from the local food bank, and they start talking about the unmet food needs. Maybe it's like a local dentistry group. Dentistry is one of the big unmet needs in our state. So maybe talking about this will then let them start understanding it, be educated, become interested, and maybe they can start becoming an advocate for changing that. So it's all about educating them. And then also, and again, and I say, don't do this on your own because you can't do work on your own, but form committees around issues and work with board members on those issues that they do care about. Talk with the other people in your department, in your organization, in your program. If you're a student, maybe talk to your teachers and see what they know about those different areas, because there's a lot of opportunities to be involved. And then also it's important to have your board, like let's say we're talking about continuing Medicaid expansion. That's something that our legislature is currently dealing with. When Medicaid first passed, that I think it was 2015, when Medicaid first passed, there was a large effort put on by our local hospitals and the lobbying that they did to let their local legislators know what would happen if local hospitals closed. Because it's not just a political issue. And if you listen to things just nationally, you may hear, well, this is a waste of government money. We don't care for Medicaid expansion and we just shouldn't do it. So if that's the case, it's important to know what that local impact is going to be. And at this time, I served on the board of St. Pat's Hospital here in Missoula. And so we really talked about what the impact would be in smaller communities with just one hospital. If they didn't have Medicaid reimbursement, then there's a good chance that those hospitals are going to close. And they may be the hospital for the area. And so without a hospital, how are people going to live there or have a business or retire there? So it's important really to engage people in those conversations. And it could be even as simple as, if you don't want to do any of this with the Board of Health, talk to your mother, brother, aunt, or uncle about how they may hate government and wasteful spending, but what it means if we actually don't continue Medicaid expansion and your small hospital is going to close. Like, talk to them about that, because it's really easy to cling to sound bites, but they aren't very frequently accurate. So that's one way that people can really help contribute to positive conversations based on facts, not misinformation. And then also think locally. If you're interested in being involved, like let's say you do this now outside of your work profession. You're too busy at work, there's enough going on there, you're looking for something else a little bit different. Well, look at what local organizations there are. They would probably love to hear from you. They'd probably love to have you involved. It's important that if you are going to be involved and you're not representing your entity, whether it's a organization or a school or a health department, that you don't act as though you are, but you can still join a board of directors or volunteer, and you're still, Jane Smith, and you work as a public health nurse and you care about local food, so you're on their board. So you're still yourself, you just aren't representing the entity that you work for. So there's a lot of ways to be involved and have another impact. that are outside of your work. And if you don't have time, many of us are really busy with everything we're trying to juggle. So maybe you don't have time to volunteer, but you just want to stay informed about healthcare issues. Find out what's going on. Collaborate with others who want to make a difference. There might even be just, if you don't want to join a group, there might be gatherings sometimes. There might be like different, if you support art and the benefit that that gives to a local community. There are different like art walks, or you could support a local artist. So there's always ways to be engaged in your community, small ways, bigger ways, formal or informal. An engaged community in a positive way is a healthy community. And so this part here is, let's see, how to interact with your Board of Health. And so for doing this, this is more if you are working and you're going to be interacting with the Board of Health. So it's not necessarily on your free time. It's more your work time. But you want to find out how policies or funding will impact people, groups, businesses, hospitals, and towns. And this goes back to like Medicaid expansion that I mentioned. And if you have your hospital shut down, what's going to happen to your town? And you can, from your viewpoint, whether it's your business or your school, talk about the impacts of that, of proposed policies. And if your Board of Health likes to be involved, they may want to write a letter in support or opposing different measures. So they still have the power to do that. And none of that was taken away with changes that happened after COVID. And then also you can enlist Board of Health members as champions. Isn't it great to have a big team of people who are passionate about the same topic? Even if you come from different viewpoints, if you can agree on certain things, you can really be a powerful force. And so if you can enlist your Board of Health members through the ways we've talked about, then they could actually be champions for some of the issues that you really care about and that are important to your community. And then also, the digital age is awesome and sometimes it's terrible, but it gives you a lot of opportunity, and it makes it really easy to network with state, local, or national organizations. And you can join trainings, you can join groups, they can just provide you with ideas that you can bring back to your own community or your own work. And there's also support and training opportunities in that would be helpful and that are on the issues that you care about. And so we talked about a little bit more how to be involved. Let's not go into social media yet. So let's talk about interacting with the Board of Health. So what are some things that, any questions or things that have come up, as we've been talking this morning, that people, what are the big issues that you are seeing that you're really concerned about or excited about? Throw something in the chat and let's maybe talk around that. And maybe you can have collective brain power around solving some of these issues. I know a lot of it, some of it right now we're dealing with is funding for schools, maybe funding, but also funding for health departments, or maybe loss of power for some of those. So that's all, things that we're dealing with. But are there specific things that people are putting in there right now? What about if we saw something dealing with, our local health departments and dealing with a loss of grant funding? And this is something that is very real as a possibility, because we are seeing some things happening federally where there are restrictions being talked about how we could possibly lose funding for different programs. And I'm curious, did anyone receive a notice within the past couple of weeks that they may be losing their grants or that this may impact them? And you can just go ahead and throw something in the chat or raise a hand if you want to talk about it at all. Because I know that was something that we had to deal with at our local health department and decide what may happen, how that will affect programs and possibly positions. And so, knowledge and planning is always really important.
Erin shared in the chat that this is currently occurring. not just restrictions, but lack of funding from CDC to the state.
Yeah, Erin, you shared that. I'm curious, are you seeing reductions in current funding that you were promised, or is it just funding in the future that you expected is not going to be in existence anymore?
So we've had one notice of award come without the funding that was promised. And that could just be delayed. We don't know. What we're experiencing is a complete lack of support right now from the CDC, including, applying for grants. There's just no support whatsoever. It's as if they're not there, which is very scary.
Yeah. I'm curious, Erin, have you do you have or have you thought of like plans going forward? Like what if that continues and what if suddenly the CDC is no longer there? What if they are not going to be the
And
agency they were before?
it's something that we're considering, but I'm not in the, I supervise people who are paid by these grants. In theory, they're state employees and the state would have to employ them to do other duties. But we don't know how that looks on a broader scale. What if it's more than a handful of people? What if it's hundreds of people? I don't know that we have a plan for that at the state level.
Yeah. Yeah, that is a very real thing that people are dealing with. And unfortunately, I don't think any of us have those answers yet. I know in setting our budget this year, I was looking at one position where it's a grant funded position. And we supposedly have the grant for this next fiscal year. We've been told we do. And so hopefully that comes through because if not, we're just going to have to, I mean, I don't know how we're going to backfill and pay some of these positions. It's something that I don't think that governments are set up to do because we haven't had to contemplate it on a broad scale yet.
Yes, and I think that people don't understand that this is not spending that's discretionary. These are when we have a notice of award, it's a contract between two governments that the federal government will supply this money if we perform these duties. So they're breaking these contracts.
Yep. There's a lot of legalities involved with that. I mean, I'm sure you're aware of some of them. So it'll be really interesting with what you're talking about. It is breaking contracts. It'll be interesting to see how things occur if our federal government just chooses not to follow the law, but I don't think we're there yet, and I don't think we need to. No one needs to be up in arms about that, but there is uncertainty, and it does definitely impact the work that we're all doing. And so it leads to a lot of uncertainty, and it could really hurt our communities, not only, our communities, but also the people who work there and who work locally.
Well said.
Yeah. Was there anything else there in the chat we wanted to talk about?
Yeah, I just mentioned the proposed reduction in IDC or indirect cost rates, potentially impacting NIH funded projects. So that's a, impact a proposed policy change that can have a huge impact across university systems, for instance.
Yeah. Speaking of university systems, it's interesting to look from a state budgetary standpoint how our funds have shifted from supporting like our state universities and how some of that has decreased over time and decreased, and we've seen spending and cuts in other areas. And now we find ourselves where a lot of universities students can't afford to go, or they have these really high debts. Has anybody read the book The Tipping Point? Or are you familiar with that? It's basically it'll be interesting to see if and when we reach a point where our communities and our people are just like, this is enough and this is a tipping point. I think it actually had to do with climate change, but it's like, you know, at what point is this going to be a tipping point for people to say we don't support this anymore and we won't keep voting for this because our votes do matter, and this is actually what we're voting for. So I don't know, a lot of that is messaging. And I'm just going off on a tangent now because I care about it a lot and it really impacts public health. Was there anybody else who wanted to say anything about what we were just talking about? All right, then let's move on to another way you can stay involved and be involved. And this is social media, which, you know, there are different avenues for social media and you can do and use them different ways. However, one thing that is interesting is it's a way to monitor different healthcare advocacy issues. And the groups who are really out there advocating, maybe before it was the CDC, but right now they're not doing much. I'm related to some people who work for the NIH, and they were no longer able to use some of their government accounts that they use to communicate on social media with the public. So there are some restrictions being put in there. That being said, there are other groups like the American Public Health Association, like the National Association of City and County Health Organizations, like our local one statewide, that are on social media. And so if you want to stay involved and feel like you know what's going on, you can follow all of those different entities. You may want to watch what sites you join and follow them on. Some sites are more toxic than others, and some sites have more misinformation than others. So, you know, you can do your research and decide which ones are best for you. But social media is one way to stay connected and connect with people who care about the same things you do. So you may not feel so alone. That being said, social media doesn't substitute for personal interaction. And so we can't just stay in our houses when it's freezing cold and 0 outside and there's really a lot of wind and snow and just stay on social media forever, because we'd all be very miserable. But it is one way to stay connected, and that you can really help identify what people are talking about or what is the hot issue that may be impacting your area that you weren't really aware of. And then you can share this with your personal or professional networks. Make sure what you're sharing is actually factually based, of course, because anyone can put anything on social media anymore. But it is one way to stay involved. And I think that we all also know that social media does have some toxic traits about it, but it can be used for good. And so it's just one thing to think about. And then here is, these are some resources that I wanted to put on here for you. We have a few minutes. If people want, I could actually go to this, or we could wrap up a few minutes early. But these are resources. This one right here is from the American Public Health Association about how you can speak for health. And they do a hashtag, and it is a whole thing that if you hashtag it, you can then search by that hashtag and you can follow along with what's being said. But there's also state fact sheets. And this APHA, they have their 2024 advocacy priorities. You can see what's important. And then there's also, they have a policy statement development process, because they do put out policy statements and they're grounded in public health. So they have a lot of topics and issues here that you would be interested in. Like I put one here for health reform. And Todd, go ahead, you'd raised your hand.
Yeah, one other thing too, and I apologize if you might be hitting it on the next slide, but just a massive resource for everybody here is Confluence Public Health Alliance. So a couple things. One is that includes the Association of Montana Public Health Officials. That's a super active group, both during the legislative session and non-session times. It's health department directors, health officers. Definitely get involved if you're a health department director. Become a member of AMFO. Hopefully you can, but you can get actively involved. And the good part there is you're not alone, especially for folks who are just dipping their toe on advocacy and policy. You've got veterans there, many of whom are on this call, who can help their work as a team. So you're not alone. Help give you guidance of working with your Board of Health. And you can be part of the bigger picture on that. And then the other two groups are Montana Environmental Health Association and Montana Public Health Association. So for regular public health workers here, maybe non health officers, another venue for working with a bigger, broader team of folks here in the state to work on policy and advocacy. So thanks, Kim. Sorry to jump in there.
No, no, Todd, thank you. Actually, you took the words right out of my mouth. And I'd mentioned that earlier, and we do have, so I think some people on the phone, Todd included, who have been involved with those. And I'm actually on the board right now of the Montana Public Health Association also. But there are, as Todd said, 3 entities depending upon where you fall in Montana. If you're a health officer for your area, then AMFO is the one that you could join. If you are dealing with environmental health areas, then it's called MEHA, MEHA, Montana Environmental Health Association. And then the one that is for people who work in public health, so the public health workers, that is the Montana Public Health Association. And that one is divided up into regions. Each region has a vice president, and they are available to members, and they can help organize members and outreach. And through all of those, Confluence is the one kind of overhead, and then there's the 3 beneath it. But Confluence does have a conference that will be coming up. They have their annual conference coming up this April, and registration is available now. So if you want to go, please go and check out the Confluence Spring Conference registration. Check out all of the great trainings that are there. There's also an opportunity, if you attend, that you can work and network with other people who do the kind of work you do, which is one of the best things about those conferences. And throughout the year, there's also a connection group online called Connected Communities. And those are where you can connect with others online about maybe dealing with, accreditation or environmental health. And then they have continual discussions as well as groups in those areas that will have conversations and that you can pose questions to. So it is a great resource in our state that we have. Okay, it looks like we're getting some other stuff in the chat there. Is there anything else there?
It's just Todd and I.
Oh, you and Todd?
Yeah, we're
You
putting
guys
in
are
all the
great.
links.
Oh, good. Thank you. Thank you for that. So you guys are doing the work for me. So those are the links that they're putting in there for you. And I'd encourage you, it doesn't hurt to even just check things out. If you can't go to the Confluence conference in person, there is almost always a virtual conference, and I think there's going to be this time too. And so you don't have to necessarily travel for that, but it's a great opportunity for being more involved. And so this is now more like our questions. What have we talked about today? What have you learned? So what do you think that you've actually, if you wanted to be involved with your local Board of Health or in policy making now, do you feel like you've learned, what would be your next step? We've had some people talk about different things. If you want to dip your toe in the water, who thinks that they might, let's see, go to the Confluence conference, please go. If you go and you're a worker, then a public health employee, then it actually counts as your membership due too. So you're now a member of MPHA. But so you could go to the conference, or who thinks that they might want to start tracking what's going on in our legislature now that you have those resources? Does anyone want to raise their hand and say things that they're watching that they definitely think that they're going to pay more attention to now? If not, let me tell you one thing that it will be happening soon in our legislature. There is a time when bills can be introduced, and then there's a deadline for where you can no longer introduce new bills. So it can't go on the entire 90 days of the session. So there's a deadline called the transmittal deadline. And that transmittal deadline will be coming up eventually, relatively soon. And so once that transmittal deadline is in effect, we have a better idea of what kind of state laws are going to be moving forward. And so that's really a good time that if you really want to see what we're going to be looking at and maybe want to really start watching these different laws, transmittal is a good time to do that. And what transmittal means is it means if it was introduced and if a bill was introduced in the House, then it will then pass out of the House and be transmitted to the Senate. So that's called transmittal deadline. And the same thing if it was started in the Senate, then it will then be transmitted to the House. And if it doesn't happen by a certain deadline, and the deadlines vary based on whether or not there's money attached to the bill and a few other caveats. But if it's not introduced by a certain deadline, then the bill will not be going forward this legislative session. So it's kind of like seeing a light at the end of the tunnel, and you're going to know what the cards are and what you will be looking at going forward. So it's a good time to, if you want to stay involved, you'll get a better idea of what things look like pretty soon. Are there any wrap-up questions? It is 10:45. So I'm available for any other questions. And on our last slide here, let's see, get to it. There, I've given you my contact information. I am so happy to connect. It says connect with us on Facebook. That's not me. You don't want to connect with me on Facebook. I don't really go on there that much anymore. Occasionally I do. You'll see pictures of my kids probably. But if you want to connect with me, there's my email, and it's my University of Montana email. I'm in the public health school there. They have great programs, whether you want a certificate or just want to attend a class or are interested in another degree, then they have great programs. And so that's a good way to reach out to me. I'm happy to talk about anything, really. I love policy. It's super exciting to me because I just think it's such a great way for all of us to use our experience and really make and shape the world we want to live in. So I'm available. And even if you just want to bounce ideas off me or anything like that, I love it. And I would look forward to any of it. And I'm in Missoula. So if anyone ever comes here or lives here, I'd be happy also to go out for a cup of coffee or tea or lunch or something too. I'm really accessible. So I'm around, and I love being involved with people and the issues that we all care about. All right, with that, I'm going to stop sharing my screen, I think. Let's see. There we go. And yeah, is there anything else? Just wrapping up.
Yep. Stephanie wants to know, since we have a little bit of time, could you show the legislation website that you mentioned earlier?
Yes. Let me go to trying to find stop share here. Let's see. There we go. Stop share. It's a little funky because we have to stop sharing and then reshare here. So here, I'll show you this because we do. Are we going till 11 or is it 10:50? Oh, shoot. That was
11. Yeah.
11. Oh, good. All right. So here, let me show you a few things. So this is out of Minnesota. And this is one thing that we've looked at doing in Missoula as part of like our trying to have a website that highlights what we do in public health. And these are all little short videos that their health department made. We are public health videos. And so they show all of these different, it really humanizes the work being done. And so, ideally, yes, we would all love for something like this, but it takes time and money. But if it's a priority and we want to prioritize different things, and this is one that I just wanted to share with you because they have a really good website here. It's health.state.mn.us, and it's under their public health video series. It's a really good one. And so here's another one. I talked about the health reform that APHA is doing. And if you go, you can see it's apha.org. And this is under their health reform page. If you want to know what's going on, I mean, they have a lot of information here. Then they also have The Nation's Health is a magazine that they have, and they do share all of that.
Kimberly?
Yes.
You're not sharing your screen.
Oh my God. Well, I'll just keep talking and you guys will be like, what are you talking about? Darn it. Let me share again. Thank you. Let me see. Let me find my Zoom link here. Zoom. Share. I apologize for that, everyone here. So now you will see, right? share. APHA, you see the APHA reform?
We do.
Thank you. And I apologize for that. I just get so excited and keep talking. So, and I'll go back to the other page, but this is that apha.org. This is their health reform. And that first video I showed you, the what is public health, that's from them. They have a lot of great videos. They have a lot of great information right here on policy and advocacy. They have policy briefs, advocacy for public health. And this will show you how to stay informed, voting toolkits, if you ever go to DC. And then I'd put a link in there about Speak for Health. And this is another one of their resources about how people are standing up for public health, but it also has state fact sheets. And so it's all of these important issues and information that we may not have. Now I'm going to go back real quick because I did not share with you. This is that Minnesota Department of Health website that they have with their public health video series. And you can see they have just short videos, but they have them on issues that really humanize, instead of just words there, it helps people connect more. I won't play you one unless you want me to, but they're really good, just basic videos, and give you an idea of what can be done with that. And I talked about the publications that APHA has. If you go on their publications and periodicals, you see that you have all of these opportunities, and then they have all of them listed there about different things you can look at. This is all online, and it's all information that is relevant to what we're dealing with in our lives. Now, this right here, this is the Montana Code annotated, and this will be where it shows you all of the laws that are passed in Montana. And they're separated by title, which is Title 50, by chapter. So health and safety, and then chapter is local health boards. And then this part 1 is this section here is your general provisions. And this was something that actually was passed in 2021. You can see here on the bottom, I'm not just orienting you so you understand how to read these things. It says that there's a history, and it gives you the date that these laws were passed, when they were changed, and you'll see a chapter number in section. This is the amendment that changed this law. And if you wanted to go back and look in these chapter books, you could find the actual change that occurred, but it was last changed in 2021. And so that's where you see it for our Montana, the Montana Code. And I'll show you and next I'll go to the legislature. Let's see. Okay, this is the Montana Code right here. You see all of it. It starts with our Constitution there. The Constitution was originally written in 1899, I think. And it was revised, which it needed to be, in 1972. And so we have a relatively new Constitution that's progressive when you compare it to other states, with some of the provisions we have in there, like a provision for dignity or a clean and healthy environment, or for privacy. Those are all things that are not necessarily found in other state constitutions. So I'm going to show you. So I'm going to type in here, just in my search bar, legislature. I'll just type in Montana legislature very generally. And you see here, it brings me to our home page. So I'll click on this, but underneath you also see the bills. If you want to, it says streaming live, so we could actually see meetings that are going on now. If you want to put together select certain bills to watch, this is your Bill Explorer and Tracker. If you want to see who your legislators are, that's what this roster does. And then this also provides you with the session calendar, which shows like when things such as transmittal occur. And so if I just click on the Montana legislature home, it's slowly coming up. They did redo this last year, and there were some challenges people thought, but let's see what it looks like. Okay, cool. So look at this. You see this? this right here is today, day before Valentine's Day. It shows you committees typically start, you have 2 committees in the morning, maybe 1 in the afternoon, and then at 1 o'clock in the afternoon, though, after lunch, the state Senate and the state House both have their full meetings where they meet as like all of them come together, not in their separate committees. All the Senate meets and all the representatives meet. So you typically maybe have like an 8 a.m. or 9 a.m. Committee, then maybe a 10 a.m. committee if you have 2 in the morning. And then you'll have your 1 o'clock session where the House or Senate meets. And then you might have a 3 o'clock committee. So it's a pretty full day. And so if we look at this and I click on this 8 a.m., it says business and labor. So it's this tells the time, committee information, and event details. I'll click on that to show you what it looks like. And so then you can see the event information, where it's going to occur, but it doesn't give you everything that is going to be occurring. If I click on committee information, I'm not sure if this will tell us who all is on the committee or if it's actually going to show us what they're talking about today. Okay, so that is all of the members. When we talked about finding people who are interested in your cause, these are your people you're going to be looking at in those different committees. And you'll want to figure out, typically working, Confluence is a great place to work, what is going to be going on. And then for the legislative public participation, if you want to testify, be involved, if I click on that, it will, if it works, it should bring us to a link that will tell you how you can participate. I haven't signed in. You have to create an account. And if you do that, then you can register to testify if you have to, or you can also give other input. So for meetings here, it'll show you when all of the meetings are. Business and labor, here are the bills. This is like the hot information, okay? So this is what they're going to be talking about. It tells you when, it tells you where. The rooms are always the same, the meetings, they're all in the same room. It tells you when, where, and it tells you who right here the sponsor is. That is a person that you may want to talk to about the bill if you can. You may not want to. So it tells you what's going to be happening. There's going to be a hearing on that day and that time. And also right here will tell you whether or not any amendments are going to be put onto it that are known. So that's a no. So what you see in looking at the bill is probably what you're going to get if you were to click on this. But this right here is a yes. And so this bill by Senator McCamey, this one may have some amendments put onto it, and those should be available. I think those are also usually available if they exist before the meeting online. So if we wanted to see what that looks like, it'll now bring us to the Bill Explorer. And I just wanted you to see this because it is really a pretty easy thing to tool around on once you get used to it. So then this is Wendy McCamey. She plays a mean piano, by the way. She and I played some duets, and when we had some time to kill. She's actually a pretty good person to work with. And then so the drafter right here is not a legislator. This person works in legislative services. They write up the bill. You can, if you want to, request all communications between Senator McCamey and the drafter if you want to see what they talked about. Those are public records, although there is sometimes a fight about that. And so then you can see what happened here. The bill was introduced, it passed the Senate, and now it's on to the House. And if it passes the House committee, it'll go to the governor for signature. And then you can also see the bill text, which is going to load in a PDF. I have 2 minutes. You show you what the status is, all the things that are happening and when. Shows you the fiscal impact. If this is going to happen, there will be a fiscal note drafted about how it impacts the state budget and how it might impact other things. Here are some amendments, and then this will have your document and links, which is the bill. These are the different drafts. So with all of that, I will stop sharing. That was a really quick run through of that website, but all I typed in was Montana Legislature, and it's a really usable website. So I would encourage you can search around and find those things that you really care about.
Thank you. That was
All right,
awesome.
well, with that, I'll say thank you to everyone. Thanks for having me, and thank you for all your work you're doing.
Well, thank you. I didn't even know about that website. So that was, that's an exciting something to learn.
That was a whirlwind. That you could do an hour on that, but it really is a good way to track things if you want to just see what's going on, and you can click in and watch the hearings from the privacy of your own home.
Perfect. Thank you so much. We appreciate your time, Kim.
Well, thank you so much.